After many long hours in the operating room, I walk down the dimly lit hallway of an austere Haitian hospital. I have to carefully watch my step as patients are lying everywhere. A few are on mattresses, but most are on pieces of cardboard, and some on nothing at all. This is evening rounds a few days after the Port-au-Prince earthquake, January 12, 2010, that claimed the lives of more than 200,000 people. Few, if any, moments in world history have witnessed more orthopedic emergencies at one time in one place. The scene is surreal. Patients line the hallways, fill every corner of the corridors, patios, and cover the grounds outside the building. Most are waiting for surgery, some are already operated. There are people who have lost limbs, kids with femur fractures, others with crush injuries, tibia fractures, ankle fractures, elbow fractures, and fractures of nearly every other bone in the body. And in the midst of this, a few newborn babies who have yet to experience the dawn of their first full day of life. I have been operating for more than 90 hours, catching just a few moments of sleep between cases by resting my head on a duffel in the corner of the operating room. Comfort and corporal desires are not of concern. Only a small portion of all the cases have been completed. I remind myself that this apocalyptic circumstance is not a disorienting, hallucinatory dream. There are no notes to write, no orders to change. In fact, there are no charts. Pre-op and post-op patients are differentiated by a piece of masking tape on the forehead. Pre-op patients read OR1 or OR2, depending on their urgency, and post-op patients are marked with a date and an abbreviated title of operation. Wound care orders are written on the dressings, and in spite of lacking pain medication, there are very few complaints. Under these adverse conditions, the beauty of the human spirit was brought forth, and in spite of horrific tragedy, God's love was felt. In pursuit of survival, life was boiled down to its most simple elements. All of the things that normally cause us stress and worry seemed trivial and silly. In the first several days after the earthquake, money was meaningless, banks were closed, gas stations inoperable, restaurants were giving away food, and people were helping people. Each of these patients had a story involving loss of life, suffering, and tragedy. One patient lay with her Bible open to Psalms 46. And then at the end of the hall, a woman lying on the floor who had been operated for a severe pelvic fracture began singing, "How Great Thou Art."